We're heading into our third COVID winter, and we're also heading into an election season where COVID doesn't seem to feature almost at all. And yet the aftershocks of the pandemic are still very much with us. To help us think about what impacts public health emergencies and pandemics have on democracy, on elections, on democratic societies, we're joined today by two UC faculty who've spent a lot of their careers thinking about these questions. George Rutherford is an infectious disease specialist and professor of epidemiology at UC San Francisco. And he's played a leading role in California's COVID-19 response and has a long history of working on other infectious disease emergencies like HIV/AIDS. And Kim Yi Dionne is an associate professor of political science at UC Riverside, who studies health, politics, and public opinion, and especially in sub-Saharan African countries. And we're here just to hear their reflections on the politics of pandemics. Welcome, Kim. Welcome, George.
Thanks.
Thanks for having us.
I want to start by asking you, George, to, as the epidemiologist in the room, to help us establish some context about where we are with COVID. We know that about 350 people continue to die every day in the US from COVID or complications related to COVID. Mm-hmm. How does COVID mortality and morbidity compare to like the flu? You know, how does it compare with the other stuff that we live with?
This is incomparable with anything since 1918, 1919. Mm-hmm. And it's huge. COVID is the third leading cause of death in the United States overall, just from crude numbers. Mm-hmm. It's the seventh leading cause of death in children. And it's the only one of these major causes of death that's vaccine preventable. And it's the fact that we're still having these conversations means that somehow people don't get this stuff, mm-hmm. Or that they're, whatever. But from a mortality standpoint, we haven't seen anything like this in the last 110, 115 years. Mm-hmm. And it's, the consequences of it are huge and far reaching. And it's a big deal. We've lost 2 years of life expectancy at birth in the United States, which again didn't happen during any of the wars. And the only thing that's comparable is the 1918, 1919 influenza.
Mm-hmm. It's amazing how normalized it has gotten, how used to death society can get to numbers that we would never have thought.
As long as it's not your death, they don't care. It's just like, I don't know, but it's, I think we've forgotten how devastating this was off the bat, right off the bat.
Yeah.
I think some part of that has to do, though, with the fact that there hasn't been a lot of leadership on how to navigate the pandemic. I think that there's been a lot of kind of decentralization of like response to the pandemic, and a lot of actually people as individuals are carrying the burden. And I think that that's part of the reason why, like, I don't think we've gone back to normal, but I do think that there's this new normal, mm-hmm. where people are so fatigued because, as individuals, they have to take on so many protective behaviors because the state hasn't been doing that for us, right? So there's things we've learned over the course of the pandemic. Certainly we didn't know things early on, but things about, for example, air filtration systems being, because this is an airborne disease, so one of the greatest ways to stop that is to make sure we have better and stronger air filtration in buildings where people congregate. Mm-hmm. And that's an expensive ask. And rather than do that, people are like, oh, well, if everyone just wore masks. But then at the same time, the leadership, right, the U.S. Centers for Disease Control and Prevention are not encouraging us to wear masks anymore, right? So mm-hmm. anyone who does, they're carrying that individual burden because there isn't this collective response. And I think that that's part of why, and I also think, George is right to this extent that if you're not the one dying, right, mm-hmm. if you're not the one with an immunocompromised health condition that requires you to be really vigilant about protecting yourself from getting infected, then you just want to move on because
Yeah.
you've grown tired of it all.
Yeah. Yeah. And it's true, even the people in my life who are the most vigilant and determined and careful, when it does all rest on the individual to do that, I mean, everyone is just utterly exhausted, and over it is like the expression, I'm over it, because it does all rest on each person almost alone, to manage this pandemic now. Well, the US midterm elections are next week, which I can hardly believe. And COVID seems to barely register as an issue, which again is in one sense really astonishing, given what an emergency this continues to be. Benjamin Wallace Wells wrote in the New Yorker just this week, and I'm quoting here. He says, nearly 2 years later, pollsters rarely ask voters about COVID policy. It's no longer front of mind. But the coronavirus and the methods and emotions of its management has supplied the fuel for just about every turn in politics since Biden's inauguration. This is the pandemic backlash election. And that's end quote. So I want to ask both of you, I'll start with you, Kim. What role do you think COVID is playing in this election cycle, if any?
I think that the claim made in the New Yorker is a bit overblown. I do think that, the most recent NPR Marist poll said that, of like many issues that are on top of mind, healthcare was about, was mentioned by 10% of a national sample of US adults as, the most top of mind issue in, preparing for this year's elections. But, the economy, the state of democracy, abortion rights, these are the top three issues that voters are thinking about. And I think those are crowding out, this issue specifically about COVID. And I think that COVID, it's not on its own, the most important thing we're thinking about, even as much as it's affecting our everyday lives, it's kind of like, asking people about the air we breathe. Like it's just around in the ether all the time. And maybe we're thinking about it when we think about healthcare, right? Like, we want to make sure that everyone has, access to good quality care. Or, we want to make sure that our, the premiums that we're paying every month to access, health insurance or our copays, like we're thinking about that, especially in this time where inflation is really affecting many more Americans in their everyday lives. Even in as much as we risk getting COVID, or many of us who are struggling with the long-term effects of having had a COVID infection, we also still have to buy bread and milk, and that, and or gas to fuel our cars. And that's something I think a lot more voters are thinking about.
Yeah. What about you, George?
It's definitely not there as an election issue. I can tell you in Europe, which is where I'm living now, the war in Ukraine is far and away number one, because that has the threat of nuclear war that hangs over it. It makes the inflation stuff completely crazy. And I think one of the few people who've been able to benefit from the pound being at parity with the dollar and the euro being less than the dollar. And it's, from a financial standpoint, it's a great time to be an American in Europe, but it's, that's what they're feeling. They're feeling the war in Ukraine, and they're feeling the pinch of inflation in the economy. The only masks you see in large European cities are on Japanese tourists. Yesterday on BART, I rode BART back and forth, the Bay Area thing to the city, to San Francisco. 90% of people had masks on.
Really?
Yeah, and it's a Northern California thing. I mean, I would have bet $100 that if you went into a mall in Riverside, you would not see you would see very few masks. But in Northern California, it's still there. That kind of pressure is still there. So now out on the street, you don't see them, but yeah, I was really quite surprised.
Yeah.
So
I can confirm mask wearing is quite low here in Riverside, California. Even at my son's school, which, is comprised of a bunch of older, mainly temporary buildings that have very poor ventilation. Fewer than 10% of children are wearing masks to school.
Yeah. It's interesting because on the one hand, when I think about the midterms, I totally agree with you guys that there are so many other issues that just swamp COVID these days. I mean, inflation, abortion, democracy, the war in Ukraine, easily. But I think, since the pandemic has kind of created some of the circumstances that we're seeing. So, for example, it's interesting that some of the candidates who have been the most permissive and who've really made it like a rallying cry to be permissive about COVID restrictions. Governor DeSantis in Florida, of course, Governor Abbott in Texas, Governor Kemp in Georgia. I mean, we're recording this interview before the midterms. It's going to air after the midterm, so we'll know then what happens. But they all seem to be doing well. And there were questions at the time, they might suffer. DeSantis might suffer. He's gonna let his constituents die, and he doesn't seem to have suffered politically. And we're also seeing, some candidates for other positions who have kind of come to visibility, who've like risen politically as these, stages or voices of anti-vaccine, anti-restriction, anti-masks. And so like that is interesting that it seems to have been a useful political tool that has brought them to this place, even though COVID may not be the thing that they're talking about. It has been very effective for them politically. And I guess that kind of leads me to my next question, which is then how do citizens evaluate their government in a pandemic, the effectiveness of their government? I mean, on the one hand, the role of government at whatever level is to secure, it's about security, it's about safety. And so you would think that, health and life would be the most compelling thing that any government can do, is to preserve and assure the safety and health of its citizens. But this seems to suggest that something else is going on, that citizens are more concerned about their economic security. DeSantis has certainly framed it that way, like, I will keep the businesses open. I'm not going to let you down. You're not going to lose my job. The schools will be open. So I guess my question for you is, do citizens prioritize sort of economics over health, or is something else going on here? And I'll start, George, with you.
Public health in the United States is very complicated because it's not mentioned. The word health or anything like approaching health is not mentioned at all in the first 9 amendments to the Constitution and the Bill of Rights. Therefore, under the 10th Amendment, it devolves to the states. So we have 50 plus, because Puerto Rico and DC and the Virgin Islands are all making their own policies, 50 plus different sets of policies. And which doesn't really happen in other countries. The Europeans are feeling it now a little bit, and they're talking about a European Health Union to kind of have a single policymaking body that would represent across the EU. But it even in England, even in the UK, England, Scotland, and Northern Ireland have different health departments with different policies. So it's very, and Wales goes with England, but it's very, it's very much of a checkerboard, and it gives you the chance to have these little cracks in the armor with different politicians running with this in different ways. So I think that's one thing you kind of have to keep in mind when you talk about government and public health, is how devolved it is in the United States. And California devolves it even further to the county level. So you have 58 counties plus 3 city health departments, Berkeley, Pasadena, and Long Beach, for those of you keeping score at home, making their own, making different policies. And I think one of the things that's happened in Northern California is that is that the Bay Area health departments, meaning basically everything that touches the San Francisco Bay, have tried to do things together. And so when the lockdown came, when the stay-at-home orders were issued, they all issued it at the same time, same language. The city, all the county attorneys' offices got together and worked it out. And we had. I think you can look around the country and say, where has this been? If you just look at mortality, right, which as the kind of final arbiter of all this stuff, in places where the government acted early and acted as cohesively as possible, the mortality is a fraction of what it was. I can tell you in San Francisco in 1918, 1919, when the city was 350,000 people, there were 3,000 deaths from influenza. This morning from COVID, there'd been about 1,100 deaths. And the city's 3 times as big. So it gives you an idea of what careful management will do. Now, there's also a lot of luck involved in that a lot of people can stay home and commute in San Francisco and stuff like that. But still, it's, those are very telling kinds of numbers, and they're similar across the Bay Area counties. Whereas Los Angeles, it's hard to make comparators to 1918 Los Angeles, where there were probably, 500,000 people or whatever it was. But it's, the Los Angeles has had more mortality than both overall and proportionately than the Northern California county, the Bay Area counties, by quite a bit. And that's not so much about the policies, although they were about a week late getting there. And that first week made a big difference. That was an extra 1,000 cases, 1,000 chains of transmission that could really spread out of control. Now, I've kind of deviated from your question, which was about the politics of all of this. I think, one of the roles of government is protection, and protecting the public health is important. And we really haven't seen that. We haven't really seen this put into play since at a broad scale since the HIV outbreak in the late 1970s, early 1980s. In which case, different states did different things. The federal government, the CDC being a bit less bureaucratic than it is now, was able to, come up with sort of straightforward recommendations. And it's, I think it's, but this was not the proudest moment in U.S. public health history. But it is, it could be, and if you were looking at the San Francisco Department of Public Health, it's so different. And even within the Bay Area, some counties did much worse than other counties, where there was sort of less adherence to the rules. Like Solano County is the one I'm thinking of. And if you look across the state, Marin County, probably the hotbed of resistance to childhood immunization in the 1990s and 2000s, has the second highest vaccination rate in the state. Imperial County, by the way, has the highest, but that's because all the Americans who live in Mexico come there to get vaccinated and show up in the numerator, but not the denominator. So
interesting.
It's a bit of a thing.
Yeah.
Lassen County in the far northwest is about 30% of people vaccinated. There's huge variation within California.
Wow. Yeah. It's interesting to think about, the fragmentation of the healthcare system in the U.S. and decentralization. On the one hand, making it easier for people to hold their governments accountable, because the decision making is happening at a level that's closer, I guess, to the citizen, the voter, to their official. But on the other hand, in a pandemic, how do you leave choices about pandemic management to each kind of fragmented geographical location? Kim, what were you going to say?
You do that on purpose, right? Like, it's by design, right? Politicians they know, right, from past experience that they're not going to be able to claim any credit for saving lives, right?
Yeah.
So what they want is to avoid any blame.
Yeah.
So what you do is, like, you don't take on the difficult position of saying, we're going to lock down the whole state, or we're going to, maybe, there were some governors, of course, that did that, right? Gavin Newsom, the governor of California, having done that in March 2020, but it's, and he suffered a lot of backlash for that. Right. And so, no one wants to suffer backlash, right? The kinds of people who can do that, right, who can kind of make unpopular policies are people who don't have to face reelection. And this is one of the challenges of democracy, right? A democracy in particular where, 50% plus one voters decides who gets to stay in office. Or in the case of, political systems in the United States, you don't even have to win a majority in some cases, just a plurality, right? So in these cases, and this is some research I've done, on HIV in Africa, East and Southern Africa, right? That the politicians that responded the strongest to HIV in the early years were dictators. And that was because HIV is one of these interesting infectious diseases where without treatment, you can be HIV positive, but not ill for 8 to 12 years because of the natural history of HIV infection. And so only dictators would presume that they would continue to be in power for that long. And so they actually saw it as something important to them because, as much as, they want to control people's lives, they don't necessarily want their populations to die, right? They need a healthy population in order for their regime to continue. And so they made a lot of efforts. But I think, I'm not saying I want to live in a dictatorship. I'm saying that, there are some interesting challenges in democracies for dealing with issues like health, where no one wants to give credit, but people love to assign blame. And I think, some of the governors that you brought up, right? Greg Abbott in Texas, DeSantis in Florida, these are Republican governors in states that are largely Republican. I'm not surprised that they are likely to win re-election. And the reasons why have less to do with COVID or even their COVID response and more to do with the fact that they're in majority Republican states where, there are rules that suppress Democrat voters, and it's in a midterm election year where economic indicators would predict more Republican than Democratic success up and down an election ballot. So I'm not surprised that they're likely to win re-election. But I also want to say there's something interesting about party politics in America today as it relates to COVID-19 response. And, and I'm not just talking about how leaders from the Republican Party responded to COVID, but the way they shaped the narrative about COVID. And the way then the people who identify with the Republican Party perceive the pandemic, right? And so, and that's been since early in the pandemic, right? Early in 2020, before there were vaccines, right? The way Republican elites framed the pandemic and spoke about it shaped the way Republican voters interpreted the pandemic. And so that's why we see a divergence in the population, largely according to partisan identification. We see a divergence in how willing people are to engage in health promoting behaviors, right? And there's a new book out on this, written by Shana Gadarian, Sarah Wallace Goodman, who actually happens to be faculty at UC Irvine, and Tom Popinski. And the three of them, they wrote this book called Pandemic Politics, and it really explores in depth some of these particular partisanship and how we understand this. But so much of this is also media framing, and I think while we might see Republicans win, that is, many elections up and down the ballot, that's if COVID hadn't been the issue, the economic fundamentals, any political scientist will tell you, the economic fundamentals would have predicted a lot more Republican success this year.
Yeah. I want to pull on a thread there about how Republicans in particular framed the COVID-19 pandemic from the very beginning, as you said. And one of the ways that it was cast and continues to be cast is as, government encroachment on individual liberty. So
Yes.
pandemic restrictions or safety measures, whatever they may be, closures, vaccine mandates by employers, masks, etc., are I mean, there have been comparisons to Nazi Germany. And although, a number of people might point out that claims like that are ridiculous, and we as a society have placed restrictions for the public good on lots of things. We have to wear seatbelts. You can't smoke anywhere you want. Despite that, I mean, this is a really deeply felt issue, and I suspect it's particularly deeply felt in the U.S. I think even among people who did go ahead and get vaccinated, who did wear masks where they were supposed to, my hunch is that a fair number of those people are probably sympathetic to the resistance to this idea of a government mandate. And public health by its very nature is very command and control. There are experts and they do research and they know what's best and they tell us what to do. But in order for public health, directives to be effective, they have to be adopted widely by ordinary people. The ordinary people have to say yes and adopt that into their life. And I'd like to hear from both of you about what you've learned in your work about these tensions between something that is fundamentally command and control, at least in a certain sense, and this resistance to being told by experts and by institutions what we're supposed to do. And this resistance seems to only be growing in the US. George, I'll start with you here. I mean, we spoke, you and I, about a year ago, actually. I did in an interview, and you mentioned then, talking about California, that the limits of what public health experts and officials can do when the population just says, enough, I'm done. How have you experienced this tension in your career? I mean, you have a long, long career in public health. Talk to me about this.
Well, it's about enlightened self-interest, I think. And, I'll come back to the example of Marin County as going from worst to first, where people really are worried about, when they're really worried about things, they want to be, they want to be directed. And people seize on things that they think are solutions. And Kim Yi, I hate to pick on you, but I'll use you as a small example, incredibly smart person who's fixed on indoor air circulation as a cause. That's a very minor thing. And you can fix it. Yeah, you can take that out of play, but you're only going to take about 5% of all the transmission out of play by fixing that. And it's really about people being right up in each other's face and coughing and sneezing. And yeah, we should do it. Yeah, we should fix it. It's probably most important for hospitals, by the way. But then, if that's the cost of getting kids back into school, well, that seems like a reasonable cost to pay, but it's not going to make a big difference. And so people will grab on things that seem to be reasonable solutions and kind of fit within within the stuff they think they can control. So this is something that a local government could take on to change the air filtration systems in schools and to make it better. But the bottom line is that you can get 95% of the way there if everybody wore masks. Now, I also think, Lindsay, that you need to go back and give the Republicans a lot of credit here. The vaccine, Operation Warp Speed, which is, it makes everybody crazy. That was a complete administrative initiative of the administration. And I think we kind of paint this as a Republican versus Democrat because of the uptake of the vaccine. But we would not have had the vaccines we have without a huge investment by a Republican-controlled federal government. And that's what's broken the back of transmission. I think that's my version of it. Now, there's a lot of going on with the virology and mutations and a tendency of a virus to become less virulent over time or better adapted to its host. which are things we can't control, but they're the things we can control. Vaccination, having people wear masks, those are important. But at the end of the day, they have to go do it. The way we've gotten around childhood vaccinations in California, at least, is that there's a law, not a regulation, a law that says if you don't have your kids fully vaccinated for X number of diseases, they can't come to school, and you have to homeschool them, and that extends across public and private schools. So that's pretty coercive, but was deemed at the time, given the high background rate, how high rates of immunity you need to get herd immunity for devastating diseases like measles, that it was worth the effort to push that through. And we're not seeing that with COVID. Now, there are a lot of technical reasons for that because of the vaccine hasn't been fully licensed by FDA. It's operating for children, at least, under an emergency use authorization, which I think precludes some of the legislative solutions that we've been looking at. But it's an important. It's important to realize how coercive we have been for some things and how non-coercive we are for others. But certain things are in enlightened self-interest. So not smoking makes it cheaper, by the way. But to get if you own a bar, and people don't come because they can't smoke, that was a big deal. And there was a famous story about La Cienega Boulevard in Los Angeles, where on one side it was Los Angeles, on the other side it was West Hollywood or something like that. It was two different jurisdictions, and and one side had anti-smoking laws and the other didn't. This was when they were all still kind of at the city level, and they were able to. There's an economic comparison that was able to show that the places where there was no smoking had, didn't have any drop off in their crowds and had much less reduced costs in terms of cleaning and insurance, fire insurance. And so it was economically, viable to do it. And the other side was losing business to across the street. So, when those things arise, we can point to those, but basically the dictum of public health is that you need to achieve your aims through the least restrictive way possible. And that's what the county attorneys will insist on. That's what the AG the California Attorney General will insist on for the state health department. And so, we have examples of where we've gone to laws as a solution for doing this, but a lot of it just remains in the land of advice. And it's the other lever we have is through the big state insurance programs like Medi-Cal, where we can say, if you want to get paid, you have to do this, 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 and this, and you have to achieve certain levels of quality, like, all women need to be screened for cervical cancer over a certain age with a certain frequency up to a certain age, and you need to have. You can't, you have to be screened for this or that or the other thing, or get this or that vaccine. That we have some economic levers that we can put onto healthcare organizations, but by and large, public health is at the level of the individual and the family. Yeah. That's absolutely true. And so people, need to want it. And I'll come back to Marin as the example of, where you went from people who said, no, we don't want this, leave us alone, to where can I get it first?
Yeah. Well, it's interesting what you said.
I'm sorry. Public health is at the level of the individual. That's really interesting, because when I think of public health, like it's public health, right? So it's not. Right. So my first book, Doomed Interventions, is makes this argument about how interventions to improve the human condition, including health interventions, ultimately rely on individual choices about whether or not to uptake certain, policies. I was thinking in particular, for example, of male circumcision to prevent HIV infection, right? Like is ultimately is going to depend on a man deciding he's going to part with his foreskin to protect himself from getting HIV. And that's a really big decision. And so, yes, there are but the individual is not the only person, right? Like there's a whole chain of actors before we get to the level of citizenship.
Yeah, somebody has to pay for it.
And so, I'm not, I'm not fixated on indoor air quality because
Sorry.
I think it's the best solution, or it will reduce the most transmission. It's a public thing. And as someone who knows that things fail at the individual level, right? As someone who's literally going to a campus where very few people are wearing masks in buildings that are terribly old and have some of the worst filtration, right? We have carbon monoxide detectors, right, that are likely to go off because it's literally, that's how bad the air quality is inside of the buildings that we're working in, and like I work on a college campus where there's a lot of social network overlap. And if I know individuals aren't going to wear masks, if I know that because it's years into the pandemic and they don't care. I mean, I'm wearing a mask because I know it protects me and it protects others around me. So I wear a mask. I know that, but I also know no one else is going to wear one.
Mm-hmm.
And that's the reality that I live in. And so if I know, right, as a social scientist who understands human behavior, if I know that people are, as individuals, are not going to take up these tasks, then we have to come up with broader solutions that don't require individuals to take that step because they're unwilling to do it. And some of that is because of our politics and how we framed it. And I agree with you. It was the Trump administration that, invested in this. That doesn't mean Republicans are taking up the
No,
there's
I mean,
only so
but I'm just saying, you give a tiny bit of credit,
I want to give more credit because here's the other thing, Lindsay, that I want to bring up about why we're facing some of this problem, and part of it is just nerds like me who work at universities not talking and sharing expertise in a way that's accessible to regular everyday folks, right? And so there's a suspicion about people like me that we're liberals who have an agenda, and not that we're people interested in understanding what's at the root of problems, and we're trying to use systematic methods to uncover that and share that with others. And that's part of what science is. But if we're not communicating that in a way that's why I love that IGCC has this podcast, because I really think it's important that more and more scientists are thinking about how the work we're doing matters for people's everyday lives and sharing that with people. Because I think part of the reason why we're seeing people rely on elites who aren't using scientific expertise or best practices is because some people just trust those politicians more. They, for whatever reasons, right? They trust those politicians more than they trust someone like me who they don't know. And I think that, that's not necessarily their fault, right? I think we're all prone to, trust really matters. And what I think we as a scientific community need to do is to build more trust with the general population. And ways we do that is, being transparent about what it is we're doing and what we're interested in. I want people to live longer, better lives. And that's the kind of research I do. And I try to do it from a perspective of understanding, how does politics help and how does it interfere with the goal of people living longer and better lives. And I'm not saying I have all the answers, but I know that there's some things that I find the evidence is very compelling. And there's some things that I know about, human behavior. And so if we can take compelling evidence about, the biomedical advances available to us and compelling evidence about how humans behave, and we put those things together and try to come up with a suite of solutions that, will have varying levels of effectiveness and uptake, and try to combat infectious disease pandemics like the one we're living in, I think that's what I want to work towards.
Do you have any follow-up, George?
No, I mean, I think you're completely right. I mean, we want people to live longer and happier lives. And I think that's what they want too. And they want their families to grow up and everybody to not to die prematurely and to wake up dead on your, 95th birthday, whatever it is, and go from like 100% to 0% overnight. And that's what people want. Now, it's not going to happen that way. And we can make that get us closer to that. But I think you're also right that communication is huge. And I spent a huge amount of the last 2.5 years, talking to the media, talking to citizens groups, talking to the League of Women Voters.
Yeah, you
just
were in the
trying to give
trenches,
people,
George.
trying to give consistent advice. And the CDC jumped around and remember the whole thing about, don't wear masks because we don't have enough. And then everybody has to wear masks. That sort of stuff could have been anticipated. And what I said is if you have masks, wear them. You may not be able to get them in March of 2020, but as soon as you can, you just wear masks and, what kind to wear and, all that stuff. You can't go down to Home Depot and buy the ones with the valve in the front of them because that doesn't do anything. But I think trying to give a consistent, relatively straightforward advice and to explain why in terms that are, don't use words like, deoxyribonucleic acid and, stuff like that to just and talk about viral evolutionary genetics. But that's what I said. I've spent my last 2 years of my career explaining viral evolutionary genetics to the lay public. So I think you're completely right. I think scientific communication is hugely important. And it's a question of consistency and clarity and actionability. It's probably not a word, but you get the idea.
Lindsay, there was one more thing I wanted to say, and this is in relation to the initial question where it was about control versus liberty. And there's a great book that just came out a couple of years ago, very, very written kind of at the very, or I should say, edited at the end, right at the beginning of the COVID pandemic. And that's the late anthropologist, medical doctor, Paul Farmer's book, Fevers, Feuds, and Diamonds. And he talks about how, he looks in particular in depth at the Ebola pandemic in West Africa in between 2013 and 2016. And he talks about how so much of the way we respond to epidemics and pandemics is control. And what he argues for is to focus, instead of on control, to focus on care. Because if we care for people when they're sick, if we really truly care, give them all that they need to be able to get back to health, that's going to encourage people to get care. And that's going to have people, seek out the care that they need so that they don't get others sick. And I think if we were to extrapolate the findings from that book to what we're seeing now here in the US in particular, I think that if we did a lot more at caring for people when they got sick, or better yet, caring for their health before they got sick, I think there might be better trust in those who are providing that care, whether that's, medical doctors or the government providing actual good quality healthcare. It's harder to hate a government that's giving you the healthcare you need. Obviously there's still party politics and media framing involved, and those are forces that we have to work against. But I think that there's something important about trying to reimagine the way we think about pandemic, and not as less about control and more about care.
Yeah, it's amazing. There's so much to this. It just seems to touch on every kind of facet of our life in the US, where the healthcare system that we have, which is, a complete outlier to the rest of every other rich country on earth, that we don't guarantee health, and the impact that has on public trust or in institutions. And there's a lot to unpack with this. It's interesting what you said, George, about, Marin County, and that story has been written up, and it's super interesting that people will be directed. We will accept direction. We are not opposed to that as human beings, but we have to want it. Like, we have to feel it deeply. And I think in a pandemic, particularly in the US, it has felt like there isn't as strong a sense of that public responsibility, like that we have responsibility for each other, and that we are so on our own and responsible for ourselves. You know, we don't pay into a public health system that covers all. We don't have an NHS here, and so part of it feels like a very kind of cultural American problem. I don't know.
Yeah,
Do you guys agree with that, or do
totally.
you think? Yeah.
Totally. I mean, living in Europe now, it's very, very different. I testified last week in the European Parliament. Don't get me started on layers of government, but it was an interesting experience. And they're talking about having a European health union with a treaty that would tie all the when you get the number wrong, 27 countries in the European Union together with a sort of centralized health authority to make these kinds of decisions. There is a European CDC in Stockholm but that's more kind of sciencey advisory, wonky stuff without real direct power. But that's how they're responding to this. And the U.S. just isn't we're just not going to go there. I don't think. I mean, Kimmy, maybe you have different ideas, but I don't see the CDC's power increasing in these areas. In fact, they took and gave some of it to the Assistant Secretary for Preparedness and Response, which is a separate arm of DHHS. So I just don't see it happening here. It's too individualized. It's too culturally different, with kind of less collective. It's not like Japan or someplace with less collective commitment to society.
Yeah.
Yeah, I think the cross-national data analysis supports this claim, right? That societies where citizens promote a collective ethos have had lower COVID mortality than societies that are that prioritize individual liberties, right? And so, a society like the US where, we're really into our individual liberties, we're one of the places that's really kind of, pulling that regression line, we with our massive mortality, not just in pure numbers, but in per capita. We, individualistic societies are not doing well in this particular pandemic. And yeah, the hard part about that finding is I'm not sure what we do, right? Like building a collective ethos, that's not convincing some person at the CDC to change a policy line. Like I'm not sure, like that's a whole big problem. And I think that's probably going to take a generation or more to change. And I do have some faith in younger people. I do think the way, they're facing these kind of really big collective events like the impact of climate change, I think that there's much more of a collective ethos among the younger generation in the United States. And that gives me hope. But yeah, it's a pretty big hurdle we're going to have to come over.
Yeah.
I think climate change is a good example of everybody trying to get together and row in the same direction. And it's going to be tough because you have conflicting economic interests, from the coal miners in West Virginia or wherever, whose livelihoods depend on, a carbon economy.
We have about 10 minutes left, so I'm going to merge two questions into one. I want to ask about disinformation and misinformation and the health of our democracy. And again, this is in a context where we do have evidence that democratic backsliding, as it is called, weakening democracy is happening all over the world. It's happening in established democracies. It's happening here. US has been downgraded by the people who grade democracies. That's the context. I'm thinking about your book, Kim, on looking at sorry, this was a paper of yours looking at the ways in which pandemics are used to marginalize groups and blame groups that are already on the outs and use them as a scapegoat. And you looked at, everything from smallpox in the late 19th century to the 1918 flu to plague to HIV to SARS to COVID. And it's just consistent, throughout all these pandemics across time, people do the same thing. People do it, politicians do it. They use pandemics, they point the finger at the Chinese, they point the finger at whoever it is, and it happens everywhere. But what's different about the time that we're in now is that we have an ability to spread that kind of misinformation. That being one type of kind of misinformation and disinformation, so much faster and at such a wider scale than we've ever had before through social media. And, disinformation, misinformation has been rife with COVID. I keep thinking about the fact that Mehmet Oz is running for Senate in Pennsylvania, and he was peddling, these like debunked treatments and prevention of COVID, but he could be a senator. I mean, it just boggles my mind. So my question for you both is, obviously, misinformation can be peddled by anyone, but what do we know about why political candidates, politicians, peddle disinformation during public health emergencies and pandemics? Like, what is the benefit to them? What do they get out of it? And do they get punished for that, or do they get rewarded? What do we know? George, you go first.
Why don't we start with Kim Yi, since she wrote a paper on it.
Kim, go to you.
Well, yeah. So I think, so to answer the question about misinformation, I don't think that, there's a lot of punishment for anyone who, peddles in falsehoods, or who, retweets a known, disinformation fact. Like it's like no one gets punished for that. People, and I'm not even talking just about politicians, but media organizations sometimes will also engage in their own kind of, it doesn't have to be social media. There are actual news media organizations that will peddle in falsehoods, or just report on a falsehood, which, political science research shows that even just without contextualizing misinformation in certain ways, you can actually promote dissemination of misinformation. So we have to be really careful how we talk about it. And I think that, part of the reason why politicians are incentivized even to, whether it's, engaging in misinformation or engaging in marginalization of already marginalized groups during pandemics, is that it's a way that they've seen works to galvanize their base. And, I think marginalization of already marginalized groups, that works if your voters are not marginalized groups, right? So that only works for a certain kind of candidate, right? Namely a white candidate who depends on white voters, right? They can do that. And in fact, right, in a time where, racial resentment is high in the American population, that actually can motivate your voters to go to the polls. And that may depress, voters who are, people of color or from marginalized groups voting for, they weren't going to vote for you anyway. So, that may just depress them from voting at all, because they're like, this person could be an elected official. Like, what is this political system anyway? I abstain. I remove my, and so it doesn't just mobilize the base of these candidates, but it depresses mobilization of the people who might support their opposition. In terms of misinformation, disinformation, these are political elites. These are people who already have an audience. They don't need things to be true to be broadcast, right? They make their truth. And I think that that's something that we have to appreciate, that something being truthful is not a necessary requirement for an elite to say it out loud. right? And whether we're talking about political elites or celebrities, right? That they actually have a significant power of shaping people's perceptions. And those perceptions matter a lot more for how people make decisions in a polling booth than the realities that exist. And because politicians have learned that, then that's their only incentive is to win office. And if we don't have something that's keeping them accountable, if there's not a check on that power, if the media isn't strong enough to kind of counter that or to stop falsehoods, right? And part of the reason why the media can't do that, one is some of them won't, but some of them can't, because if you challenge a politician, they may just decide to not come on your show because they don't actually need your show anymore, because they have this other place where they have a megaphone and they can reach many people without you. You actually aren't mediating my access to an audience. I have this other social media platform where I can talk to people directly.
George, how about you?
Yeah, I mean, I think, what Kimmy says is completely correct. And, we live in this age where there's instant replication of all sorts of various feeds of stuff that may be fabulously wonderful or maybe horrible. I'm reminded of Dr. Robert Wakefield, who was a big advocate of childhood vaccination, in particular measles, mumps, rubella vaccination being associated with autism, and he was British and was eventually sanctioned by the British Medical Association and had his license taken away. He, of course, relocated to Los Angeles in about 2 seconds, but that's another story. But it's, that's the kind of the one consequence that I can think of people who are very much out there on the edge. And for every, snake oil salesman who's pushing ivermectin or hydroxychloroquine or whatever, that's going to be without, they're just, that's, they'll have to pay reputationally, and nobody will remember it. So it's very problematic. And I think the other thing is that we didn't touch on are state actors deliberately injecting disinformation. And we know that the Chinese intelligence agencies have done this. We certainly know that the Russians have done this. And I think that's the other thing you have to be cognizant of, that when you have unfettered access to whatever you want to say to whomever you want to say it, others will take advantage of it. Outsiders will take advantage of it.
That's I mean, this point that you bring up, George, that's really important about, there are actual disinformation campaigns by external state actors, that just shows the influence and power of media companies, social media companies that provide access to these audiences for these external state actors to engage in these kinds of misinformation and disinformation campaigns.
And when Mr. Musk talks about taking all the controls off of Twitter, that's just going to be, a field day.
Last question for you guys, as I know we're running past time. I'd like to ask you what you'd like to see in the U.S. in terms of the politics of the COVID-19 pandemic. We will lead very soon in this country, inevitably, into an early presidential election cycle. It remains unclear whether Trump will run again, but I don't think things in this country are going to get less contentious anytime soon or less polarized anytime soon. Putting aside craven politicians who will always exploit things for their own interests, that group, let's talk about the public servants who are interested in the well-being and the prosperity and equity of Americans. Let's talk about them. If you were God of the universe, what do you want them to know? What do you want them to hold on to? What do you want them to do? if you could talk to them about what they should do on Monday morning. We've talked about a lot of really complicated things, some of which are not going to be changed in our lifetime, perhaps, but this deep distrust in each other, in institutions, a healthcare system that is far from equitable, and so many other problems. And yet we do have the tools to solve. For COVID, we have a vaccine, we have the tools. So in this complicated, fraught context, what do you want those public servants to know? Start with you, George.
Well, thanks. I think people need to have a moral compass, and that they need to be saying that they're working for the betterment of society. And how you're going to get there is, different people will have different triggers to get there. Some will see it as economic growth, and clearly economic growth. The richer countries have better health indices. And the poorer countries don't, with the exception of Cuba, which has prioritized healthcare over everything else. And so it's so I think you have to let the electorate decide whether they want to have have a complete reliance on economics. And you saw what happened to Mrs. Truss in the UK the week before last. That she lasted 6 weeks in office or whatever it was. And it's just not that may, that I think it was recognized there that was completely the wrong thing to do. And the markets responded and punished her quickly and swiftly. So I think that's not our system. You got somebody for 4 years, or 2 years in the case of the House of Representatives, or 6 years in the case of the Senate. But it's, you'd like to have, people have the moral compass to say what we're trying to do is to improve the health and well-being of society, rather than to get reelected. And I think that's the kind of moral, and society's everybody. C. Everett Koop, who was the Surgeon General under Reagan, was very conservative. I mean, very conservative. And his background was he was a chief of pediatric surgery at Children's Hospital of Philadelphia, a renowned surgeon, but deeply, deeply conservative. And was asked the question about, gay men and HIV. And he said, I didn't notice that anybody appointed me to be Surgeon General for everyone who was not a gay man. I'm the Surgeon General for everyone. And my bailiwick, my remit is everyone. And I thought that was I'm not doing it justice, but I thought that was the right response. And it's something that I think everybody needs to keep in mind as they try and balkanize and marginalize certain groups.
Mm-hmm. I think I would just say that, I think I'd want public servants to know that I really appreciate the service that they're doing for the sake of others. And I think that they should know that there are a lot of people out there who really do appreciate their work. It may not be obvious to them, I think, in the way that people talk about, for example, election administration officials or public health officials who are in fact trying to look out for the health and the well-being of other citizens and of democracy as a whole. I think it's important for them to know that there are people who are grateful for their service. I think it's important for them to think about why they originally got into their line of work. I'm sure that was motivated by an interest in helping others or making a contribution. And I think, I think it's important to look at that, because I think in a difficult and dark time, you need that as your light to guide you through it. And so I hope that, they would look to that as their guiding light. I also hope that they might share with the people who are, friends and family and maybe just others around who are willing to listen about how the actual work that they do. Because one thing that I struggle with is people are like, oh, government's too big. And I was like, okay, who do you want to fire? Do you want to fire the public school teacher who actually only makes like $36,000 a year if she lives in Alabama? Like, do you want to fire her? Or do you want to fire the person who sends you your water bill every month? Who would you like to, public servants exist to serve the public. They actually have work to do every day, and they help keep us able to access public roads to get to our jobs or take our kids to school. They're the ones who make sure that the food we're eating is not contaminated or spoiled, and that it's safe to ingest. They do things that just help us live our life day to day. And I think a lot of people forget that, that these are not just people freeloading for a pension. These are people who actually make our lives possible. And so the extent to which they see themselves not just as appreciated, but as necessary, and to think about how what they're doing makes an impact, even if it's not a direct impact, right? Not a direct impact, for example, on COVID transmission or care of COVID patients. The fact that you're making sure that the roads are safe is what helps doctors get to their jobs or ambulances get to the hospital. There's if we want to start imagining ourselves as a true collective in the future, right, we have to think about how we're connected to other people and how what we do is important for other people. And if we can start thinking about those connections, then we might get to that point in the future where we really are worried about not just the people who live in our house, but the woman at the grocery store who we can't tell is immunocompromised and really needs us to wear a mask because we might be asymptomatic carriers of some infectious disease. That we have a different ethos about how we interact with other people, that we actually care about them, even if we don't personally know them.
Mm-hmm.
I was just going to say, when you're talking about, who do you lay off in government? Michael Lewis wrote a book called The Fifth Risk. That's about when they froze government, who got laid off, and it was the people who figure out if you fall off a boat where you drift to, and so, so I'll say pretty important stuff.
Yeah. Thanks to both of you for talking. I could take this on for hours with you guys. You have both had incredible careers, such interesting work, and I really appreciate your time. Thanks for being with us on Talking Policy.
Thanks,
Great.
Lindsay.
Thank you.
We'll cut the audio